Well, hello and welcome to Ask the Doctor. My name's Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania, Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time today. I see we have our guest back today.
Yes.
Got a special guest in the studio. On today's episode, we want to talk about this problem of the SI joint. And in doing some research, I came up with a couple quotes that I think we need to address early on. One of these was in the Huffington Post, and it talks about how they're recommending chiropractic care for sacroiliac joint derangement, and it says this Dr. Fishman stressed that most establishment doctors aren't as good at diagnosing and treating this as osteopaths, chiropractors, and PTs, so it might be a good idea to go to these professionals. So I think people are starting to realize that, you know, they can't handle everything with a drug. They don't know all the causes of these things. And from an SI joint problem, you know, focusing in on that chiropractic is really the way to go. So what can you tell us a little bit about that?
A lot of people have this, and it's a shame. They go to the medical doctor, and at one time in Gray's Anatomy, Jerry, Gray's Anatomy said that the SI joint doesn't move, which of course that's ridiculous. Okay, women get this a lot. What happens is their ligaments get loose. And think of this as the sacroiliac joint. Basically what it means, it slips out of place like this. Okay, so we're trained to diagnose it and we're trained to fix it. That's the good news. And this can be a very, very severe problem. They can have severe pain where they want to go to the hospital in an ambulance. And you know, I've had people come in here like that and they say, if you can't fix me today, I'm going to the hospital. And I say, well, let's check it out, let's find it, let's adjust it. And like 3-4 days, they're tremendously better. That's the kind of results we get with this.
Because I would imagine that more than likely, if I had this problem, and if I went to my normal family doctor, I'm more than likely going to get a muscle relaxant and a anti-inflammatory.
That's all they know.
I'm probably going to get the two drugs, which I get for 90% of the problems that you would go there for.
Why'd you go to medical school for?
Yeah, right. I think I could do that. I have the same prescription, but that is the unique thing as we talk on this show about chiropractic care. That really getting down to it, and I think sometimes people look at these things in such a complicated manner, when most of our problems, in my opinion at least, are relatively simple and get down to some basic function.
I say this all the time to my patients. I say, you don't have to go to Antarctica looking in the belly of the white whale for your cure, Susie. Why? And she says, why? And I say, because the cure's in your own back. They don't look at the back.
Right.
They want to look at your organs.
Yeah.
Okay? They want to look at the front. We look at the back. I mean, that's what we're trained. We're back specialists. We're nervous system specialists.
And one of the other things that I saw was on the Dr. Oz show, and actually on the blog post that you did for this, we're going to actually have this video in it. But it talked about how this doctor performed two side adjustments and one mid-thoracic adjustment, and when Dr. Oz asked the volunteer how those adjustments felt, her answer was simple: awesome.
That's my experience. That's my experience.
So, I mean, you would take something like this, which after, when you're talking about an adjustment or two and having such great relief, where now when you're talking about the adding all these drugs into your system, trying to almost mask the problem, without really correcting it, you're never going to get true relief unless you correct the root problem.
Yeah, I mean, you can get relief with drugs, but the thing is you get addicted to the drugs if it's a narcotic, and then there's going to be side effects, and of course drugs damage your kidneys and liver. Think about chiropractic. We're going to give an adjustment to the SI. There's no drugs, there's no surgery, there's no side effects. You feel awesome. I get that all the time.
And don't you believe that when you treat these things with just a drug concept, in my opinion, it's kind of just like a cycle. You're just kind of you quiet it down and it comes back. You quiet it down and it comes back, because you're never really treating the actual problem. We're treating the symptoms of it, but never the actual problem. You're
getting a treatment, but there's no correction, there's no fixing. I forgot to mention one thing. We do something different in this office here. We do a thing called SOT, which is Sacro-Occipital Technique. In SOT, usually people that have SI problems, it's called a category 2. And basically what it means, it's a simple thing, that the SI slips out of place. The patient's own body weight lays on the blocks. The patient's own body weight, Jerry, does the correction. That's the good news. So it's a painless procedure, and basically what you're doing, you're taking the SI and you're wedging or blocking that side that slipped, and you're bringing it like this. So once that happens, you can do that in a relatively short period of time. Everything's in place. We're not just treating them, Jerry. We're fixing them. We're correcting them. See, when you're category 2, walking, moving helps. But if you're sitting downtown Pittsburgh in a chair all day, that's the worst thing for this, okay? And so therefore, they're popping pills as they're sitting in the chair. Of course, they move around, they walk around the mall, they're better. But we can actually fix it, and it means once they're fixed, Everything they do in their life enhances their spine, except for, of course, two things. No bungee jumping, no breakdancing.
Oh, shucks.
Sorry, Jay.
But, I know there's a lot of people out there that are probably dealing with this kind of on a chronic basis. It kind of, comes and goes, periodically throughout the year. And they're really, they might be on here looking at, I've had that similar, type of pain. And whether it's SI joint or not, if it's low back related, I mean, you definitely got to come in here, schedule an appointment, and get a good evaluation. I think everything starts with that.
I would. This is simple to find, okay? I'm doing this for 30 years, okay? It's simple to find, it's simple to correct, which means truth is simple. I don't have to inject you with anything. I don't have to give you cortisone shots. My understanding, cortisone shots, that has side effects where it destroys your soft tissue. Barry Bonds was taking steroids, and he was an evil person for doing that, and then you go to the medical doctor. What does he do? Gives you steroids.
Yeah.
How's that any better? It's still a drug is a drug is a drug.
Yeah, I just think we're so quick to jump into that arena, into the taking these drugs for treating these things when it could really be as simple as a couple visits and, throw the drugs out, you don't need them, get the actual problem treated and have the relief.
I think to me the SI is kind of a quirk. It's like they don't learn this in medical school because of Gray's Anatomy saying it doesn't move. So if they don't learn it in medical school and a patient comes in with an SI, they're not going to be readily recognizing it or treating it or know how to treat it. So therefore we kind of specialize in this.
Yeah. Well, and I think when you look at this whole drug concept, I mean, you have some inflammation there. Okay, so that's their reason for saying take this medication. But really, I think what we want to stress is you guys get down to the root cause of this. What is causing the inflammation? Right?
Doctors of cause.
Right. What caused that to take place, and how can we correct that, which will then take care of the inflammation?
99 times out of 100, if somebody has SI and they're inflamed, which they are, and they put heat, the heat makes them worse. So maybe somebody tells them, a professional tells them to put heat. The heat actually makes it worse. When they come in initially, and I found out they're category 2, I put ice on them for that week, for the first 3-4 visits. And then after the 4th visit, that's the kind of results we get. They're 40, 50, 60% better. They're happy, they're doing things, they're able to do things. Versus before, there's only one thing you can do when you have an SI, that's walking. Everything else, you have to kind of put lifting, you can't do that. So this kind of changes their life in a way.
Well, and I think just as a quick tip on our video here today, if you're looking at this, do I put heat or do I put ice? My opinion is, I would always start with the ice.
Can't go wrong.
Because that
it's inflamed.
That is a safe place to start, but applying heat to something can, cause that to be,
If somebody has an acute flare-up, an acute inflammation, you always go ice. If it's a disc, if it's an SI, if it's category 2, always go ice.
Yeah. If any doubt, go ice.
I would agree. You're like a doctor, Jerry.
Hey, I'm learning a lot on this show. So anyway, but one of the things, as on all these shows that we really want to stress is that, chiropractic, that connection it has to all of the problems that we take place. And, when you look at these types of problems and irritation of the nerves and the inflammation in these areas causes a lot of other problems as well. So you can start off with something that's more localized, then can go out and cause other problems. So having a good, thorough chiropractic evaluation to truly get to the root cause, look at your overall function. I'd be willing to bet that a majority of the people come down here, you actually find things that are taking place in their function and in their spine that they didn't even know they had.
That's true, because things are clinical and there's things subclinical. The subclinical is the 90% of your nervous system that's silent, where it's the silent killer. Of course, an example that everybody knows about is heart disease, high blood pressure. You could have it. You could have diabetes. You wouldn't know it. It's the same with misaligned vertebrae. You could have a subluxation, which is a misaligned vertebrae. 90% of the time, you wouldn't know it until the symptom is the last stage in the disease process, where it's the last thing to come, the first thing to go. So 90% of the time, you could have misaligned vertebrae, and you wouldn't know it. It's kind of we call it the silent killer.
Yeah. And that's where I think that initial, just coming out, if you've never used chiropractic before, now is the time to come down and get that evaluation. And as I always say, the greatest thing is this is a win-win across the board for everybody because of your free new patient evaluation, where they get to come down and experience Wellness Associates, get that evaluation, meet Dr. Goldberg, kind of see what this is all about and the impact he can have on your health. You cannot go wrong with that. So we encourage you, pick up the phone, give Dr. Goldberg a call, come down to Wellness Associates, experience what this place has to offer, the energy that is here, the feeling of well-being you're going to have. And I think if you'll give chiropractic that shot, it'll be a lifetime thing for you. And maintenance is key. We always want to try to prevent things. I mean, why do you change your oil and do all those things? You want to prevent future problems. We have to stop taking this approach where we wait for the problem to come and then we treat it. Let's get into some prevention and really, that'll change healthcare right there. It's just looking at prevention. So thank you very much for watching our show today. We hope you find all of our shows to be kind of informative and educational for you. We've got a lot of great shows coming up this month where we're going to be talking about such things as adrenal gland deficiency, which you could be dealing with right now. A lot of things like that I think our viewers are going to find very interesting. So a lot of great things coming up this month on AskDrGoldberg.com, and we just really appreciate you spending some time with us and hope that this information can make an impact on your health. So thank you very much for watching, and we'll see you on the next episode.